Diabetes is a chronic condition affecting millions worldwide. It impacts how our bodies use glucose, a type of sugar that serves as our primary energy source. Insulin, a hormone produced by the pancreas, acts as a key, allowing glucose to enter our cells to be used for energy. In diabetes, this process is disrupted, leading to high blood sugar levels, which can cause various health problems. Uncontrolled diabetes can lead to cardiovascular disease, nerve damage, kidney disease, vision problems, and other serious conditions. Early diagnosis and proper management are essential in preventing or delaying the onset of complications, ultimately improving the quality of life for individuals living with diabetes. This essay aims to shed light on type 1 diabetes, a specific type of diabetes that often presents in childhood or adolescence. Diabetes is not a one-size-fits-all condition. The most common types of diabetes are type 1, type 2, gestational diabetes, and other rarer forms like MODY and LADA. Type 2 diabetes is the most prevalent form, accounting for about 90 to 95% of all cases. Gestational diabetes develops during pregnancy and usually resolves after childbirth. MODY, or maturity onset. Diabetes of the young, and LADA, or latent autoimmune diabetes in adults, are less common forms of diabetes. Understanding the distinctions between these types of diabetes is essential for proper diagnosis and treatment. While some forms like type 2 diabetes can often be managed with lifestyle modifications and oral medications, others, like type 1 diabetes, require lifelong insulin therapy. Type 1 diabetes, formerly known as juvenile diabetes or insulin-dependent diabetes, is a chronic autoimmune disease. The body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Unlike type 2 diabetes, which is often associated with lifestyle factors and obesity, type 1 diabetes is not preventable and is not caused by lifestyle choices. Living with type 1 diabetes requires careful management of blood sugar levels through insulin therapy, regular blood glucose monitoring, and a healthy lifestyle. While the exact cause of type 1 diabetes remains elusive, scientists believe it arises from a complex interplay of genetic predisposition and environmental triggers. Research has identified several genes associated with an increased risk of type 1 diabetes. However, having these genes doesn't guarantee someone will develop type 1 diabetes. Environmental triggers are believed to play a crucial role in activating the autoimmune response in genetically susceptible individuals. Some potential culprits include viral infections, dietary factors, and exposure to certain toxins. For instance, certain viral infections such as enteroviruses and rubella have been linked to an increased risk of type 1 diabetes. Dietary factors, such as early exposure to cow's milk protein and a lack of vitamin D, have also been implicated in the development of type 1 diabetes. Understanding the interplay between genetics and environment is crucial in developing strategies to prevent and treat type 1 diabetes. Recognizing the red flags. Symptoms of type 1 diabetes. Type 1 diabetes often presents with a rapid onset of symptoms, which can be quite severe and require prompt medical attention. The classic symptoms are often referred to as the 4 T's: increased thirst, frequent urination, increased hunger, and unexplained weight loss. Increased thirst and frequent urination occur because the body tries to flush out excess glucose through urine. Increased hunger and unexplained weight loss occur because the body can't efficiently use glucose for energy without insulin. If you or your child experience any of the symptoms of type 1 diabetes, it's essential to consult a healthcare professional immediately for proper diagnosis and treatment. Section 6. Diagnosis, confirming type 1 diabetes. Diagnosing type 1 diabetes involves a combination of medical history, physical examination, and laboratory tests. The most common blood tests used to diagnose type 1 diabetes include random blood sugar test. A random blood sugar level of 200 milligrams per deciliter or higher, along with symptoms of diabetes, suggests diabetes. Fasting blood sugar test. A fasting blood sugar level of 126 milligrams per deciliter or higher on 2 separate tests indicates diabetes. A 1C test, an A1C level of 6.5% or higher on 2 separate tests indicates diabetes. Autoantibody test. The presence of these autoantibodies confirms an autoimmune attack and supports the diagnosis of type 1 diabetes. Early diagnosis and treatment of type 1 diabetes are crucial in preventing acute and chronic complications. Section 7. Managing type 1 diabetes, treatment strategies. Managing type 1 diabetes requires a lifelong commitment to blood sugar monitoring, insulin therapy, and lifestyle modifications. Insulin therapy. Since the body can't produce insulin on its own in type 1 diabetes, insulin therapy becomes the cornerstone of treatment. Insulin is typically delivered through injections using a syringe, insulin pen, or insulin pump. Blood sugar monitoring. Regular blood sugar monitoring is crucial to track blood glucose levels throughout the day and adjust insulin dosages as needed. Individuals with type 1 diabetes typically check their blood sugar multiple times a day using a blood glucose meter. Lifestyle modifications. In addition to insulin therapy and blood sugar monitoring, lifestyle modifications play a vital role in managing type 1 diabetes. Healthy diet. Following a balanced diet that's low in saturated and trans fats, cholesterol, and added sugars is essential. Regular exercise. Engaging in regular physical activity helps improve insulin sensitivity, manages weight, and reduces the risk of cardiovascular complications. Section 8. Living well with type 1 diabetes. Lifestyle modifications. Living with type 1 diabetes requires adapting to a new normal that revolves around managing blood sugar levels, nutrition, and meal planning. Adopting a healthy and balanced diet is paramount for individuals with type 1 diabetes. Carbohydrate counting. Understanding the impact of carbohydrates on blood sugar levels is essential. Glycemic index. Choosing foods with a low glycemic index can help manage blood glucose levels more effectively. Regular meal timing. Consuming meals and snacks at consistent times throughout the day helps regulate blood sugar and prevents significant fluctuations. Physical activity and exercise. Engaging in regular physical activity offers numerous benefits for individuals with type 1 diabetes. Improved insulin sensitivity. Exercise enhances the body's response to insulin, allowing glucose to enter cells more efficiently. Weight management. Maintaining a healthy weight reduces insulin resistance and lowers the risk of cardiovascular complications. By embracing these lifestyle modifications, individuals with type 1 diabetes can live full and active lives while minimizing the risk of complications. Section 9. Diabetic ketoacidosis, a serious complication. Diabetic ketoacidosis, or DKA, is a serious and potentially life-threatening complication of diabetes that occurs when the body doesn't have enough insulin to use glucose for energy. As a result, the body starts breaking down fat for fuel, producing ketones, acidic byproducts that build up in the bloodstream. DKA primarily affects individuals with type 1 diabetes, but can also occur in those with type 2 diabetes under certain circumstances such as severe illness or infection. Causes of DKA. Several factors can contribute to the development of DKA, including missed or inadequate insulin doses and illness or infection. Symptoms of DKA. The symptoms of DKA often develop quickly and can include excessive thirst and urination, nausea and vomiting, abdominal pain, fruity-smelling breath, rapid breathing, and confusion or lethargy. Prevention of DKA. Preventing DKA involves careful management of blood sugar levels, adherence to insulin therapy, and prompt attention to any signs of illness. Regular blood sugar monitoring. Checking blood sugar levels frequently, especially during illness, helps identify high glucose levels early on. Consistent insulin therapy. Taking insulin as prescribed, even during illness, is crucial to prevent DKA. Recognizing and reporting symptoms. Seeking immediate medical attention if experiencing any symptoms of DKA is essential for prompt treatment and preventing complications.